What is the pancreas? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Tina Nunziato and with me is the beautiful Dr. Liz Cruz. Dr. Cruz, welcome to your show.
Thank you, Tina.
Thank you so much for joining us here today. It's time for another GI Focus. It's been a while since we've done a GI Focus, Dr. Cruz, but we appreciate you being here and being with us today and learning about the pancreas. We know you could be doing a lot of other things aside from learning about the pancreas. So great job continuing to tune in and learn. So, Dr. Cruz, thought it would be fun to talk about an organ we haven't talked about for a while.
Yeah, absolutely.
The pancreas is just such an intriguing organ.
It is. It is a fascinating organ.
Yeah, so first, just tell us, what is the pancreas?
So the pancreas is actually a gland that sits in the upper part of your abdomen, your abdominal cavity, behind the stomach. So it actually sits down, deep, low, in the upper part, but way back.
Way back.
Way back.
Okay.
Right.
How big is it, approximately?
Oh my.
It doesn't have to be exact.
All right.
I mean, are we talking like a mango? Are we talking
like a mango?
Yeah.
Maybe like an elongated mango, like a skinny mango that starts out a little bit bigger on one end and then goes out. It kind of looks like, I don't know, like a state. I'm just trying to think what state it is.
Like one of the United States.
Like one of the United States that goes
like Kentucky,
this way. Maybe Kentucky.
Or Tennessee, maybe.
Maybe, yeah.
Tennessee.
Maybe.
Okay.
I mean, yeah. Anyways, I don't even know why I brought up a state.
Awesome.
Just kind of reminds me of the shape, shape of a state, or maybe the shape of Puerto Rico.
Okay. All right. Very good. Excellent. So tell us about what the pancreas does. Why do we have a pancreas?
So the pancreas is really very important organ. So I kind of divide the pancreas into, when I think about it, into two different functions. It has an endocrine function, which means it's responsible for the production of insulin, which is very important, right, to keep our sugars under control. And it also has what we call an exocrine. So endocrine, with making insulin, I would say that's the primary job. Exocrine, where it secretes certain enzymes into the digestive tract to help with the digestion of food.
So let's talk about that specifically,
Okay,
since
sure.
we work in the digestive field.
Exactly.
Right? So what are some of those? I mean, are there certain pancreatic enzymes that it excretes? Where exactly does it excrete them?
So there's two main enzymes that are made by the exocrine part of the pancreas. You've got amylase and lipase. All right. Amylase can also be made in other parts of the body, like you've got glands, salivary glands in your mouth that are down at the bottom of the mouth that help to secrete enzymes, one of them being amylase, to help with the digestion. So as soon as you start thinking about eating, you know how your mouth starts to salivate?
Right, so
it is. It is. You've got saliva that's being made. You've got this amylase that's being secreted by the salivary glands. So yes, digestion does start the minute you start thinking of eating or you smell something that smells amazing. And so you've got the amylase that's made also by the pancreas. And then lipase is actually very specific and made mainly in the pancreas. And that also is an enzyme that's secreted. These enzymes that are coming out of the pancreas are being secreted out into the small intestine, the beginning of the small intestine in the duodenum.
So after the initial digestion takes place in the stomach, as the food begins to move into the small bowel, that's where those enzymes are being
Exactly.
Okay. And I know there are some people that have like pancreatic insufficiencies with regard to enzyme production, and there's medicines that they can be on, or are they literally just taking a high dose of enzymes?
Yeah, they're actually enzymes.
Okay.
They're actually pancreatic enzymes that are formulated and made by certain pharmaceutical companies that will have a combination of amylase and lipase. So amylase is to break down like carbohydrates, and then lipase is to break down fats. Okay, and so yes, for people who have insufficiency where they're not making these enzymes for whatever reason, they can be put on pancreatic enzymes that they would take with their meals to help them digest. Now, having said that, it's crazy that a lot of these pharmaceutical companies that have made these medicines, like even some of these pancreatic enzymes that have been out for years and years, it can be very costly for the patient, even if they have insurance. So another form of enzymes that one can get are digestive enzymes, okay, which we actually carry, and which we actually use a lot, with our patients, with clients that may not be patients but find us. We use a lot of digestive enzymes, and so our digestive enzymes have a combination of amylase, lipase. There's also cellulase, which actually helps to break down like certain fibers. Okay, helps to break down
like greens.
Exactly, like greens. There are greens that we eat that we don't break down very well, and so cellulase is something that is very useful in helping to break those down.
Now, if you had, because I know my grandmother had pancreatic cancer, and it's one of the, it's apparently one of the worst cancers you can have. I don't know, maybe you die quickly from pancreatic cancer?
Well, it's that usually by the time it's found, it's already so advanced.
Right, okay.
Yeah.
So if someone had pancreatic cancer or something wrong with their pancreas, could you have a portion of your pancreas removed and still be able to live with just a portion of your pancreas?
Absolutely.
Okay.
Yeah, absolutely. There are people that will have, a part of it removed for different reasons, and who still, have a part of it that they can absolutely live with. Now, they may still at some point need pancreatic enzymes, and so they may need to be put on supplements.
So who are the people who need both? Like, could someone do a digestive enzyme and not have to worry about pancreatic enzymes, or are there people out there that would need both? Digestive enzymes and pancreatic enzymes?
Yeah, that's a great question. There may be people out there who would need both because they may need that extra pancreatic enzyme. So for example, a person with chronic pancreatitis, okay? So this is someone who's just had probably several or multiple injuries to the pancreas, and usually these are people that have had multiple bouts or episodes of acute pancreatitis, and just over time, because of the constant acute inflammation, they start to develop scar tissue. Okay, they start to develop scar tissue. They may even form stones in the ducts in the pancreas that just further causes more issues with obstruction, where they continue to get episodes of pancreatitis. Those patients are usually the ones that will benefit and that will need higher doses of the pancreatic enzymes, maybe even higher doses than what they can get in a digestive enzyme that has, all of those. It has protease, it has everything, but some of those people may actually need higher content of the pancreatic enzymes.
Okay, and so it's almost like a fatty liver, but with the pancreas, with the stuff that gets the scar tissue.
The pancreas can get fatty also.
Okay.
Yeah, the pancreas can get fatty. The pancreas can shrink. That's called atrophy. But yeah, these people, just because they've had so much insult to their pancreas. They just have a hard time with their production. Their pancreas really struggles with producing these enzymes, and so they need the supplementation.
What kind of things happen to the pancreas that cause those acute itises? Let's call it,
Like, why do they get that pancreatitis to ferment? Okay, so there are different reasons. I would say the two most common causes in the United States are gallstones. Okay, gallstones, and usually the treatment for those people is removing their gallbladder, right? And you would think that hopefully with removal of their gallbladder, now they're not going to have more episodes. However, you can actually form stones. Your gallbladder could be gone, and you could still form stones in the bile duct, which if you are forming stones in the bile duct, those little stones can still get stuck at the exit when they tries to come out, and could cause a backup, and which could lead to pancreatitis. Also alcohol. All right. Alcohol is a big one. It's a big one.
It affects the liver and the pancreas.
And the pancreas, yeah, absolutely. People can develop alcohol-induced pancreatitis. And if they don't quit drinking alcohol, they're going to continue to have these episodes.
And the gallbladder, you mentioned the gallbladder and the gallstones. There's a test, an ERCP. Is that what is used to try to go in there and determine where are the stones? Is the bile duct backed up? So on and so forth.
Absolutely. So let's say that this person has an ultrasound done, or an MRI, or a CT scan that shows stones in the bile duct. Like, let's say that they've had their gallbladder removed, but now they've got a bile duct that is enlarged, and so an ERCP is typically the test. I mean, nowadays we do a lot of MRI to image the bile duct, the pancreatic duct. It's really a great study. It's called an MRCP, and it's a fantastic study for looking at those tubes, those ducts. But if let's say that there are stones that are up there in the bile duct, an ERCP would be the test that is done where they go in. It's like an endoscopy test, but they're going in so that they can get in the bile duct to try to get those stones out.
All right, so it's used to remove the stones.
Right, to remove stones. Sometimes they have to make a cut to open up the bottom of the duct, so that it's a little more open to allow stuff to drain, allow stones or things to drain through. So that's one of the indications for the ERCP.
Are there any other tests that are used aside from the MRCP, ERCP, for looking at the pancreas or helping the pancreas?
Yes, absolutely. So of course there's radiology testing. Okay, CT scan, MRI, ultrasound is okay. It's really not the best for looking at the pancreas. A lot of times you have loops of intestine that are lying over the pancreas, and it doesn't allow the ultrasound waves to really get in there deep enough to get a good look at the pancreas. But CT scan and MRI, okay, those are typically the tests we'll start out with when if we're concerned that there's something going on with the pancreas. And then we already talked about MRCP, which is a form of an MRI that's specific to the ducts. And then you've got ERCP. Then you have endoscopic ultrasound, which is really a beautiful test for getting a really great look at the pancreas. And by the way, when we were talking about causes of pancreatitis, there's other causes that we didn't talk about. There's genetic, diseases. There's other things that can cause pancreatitis, but I was just focusing on what is the most common, at least here in the USA. Okay. So yes, EUS, endoscopic ultrasound, is really a great study for getting a really great look at the pancreas.
Well, I think we should do our next GI focus on the EUS.
Yeah, absolutely.
I think that'd be an
Absolutely.
awesome
We
discussion,
definitely,
so.
yeah, we'll do that.
Wonderful. So anything else on the pancreas that you think would be helpful for everyone to know?
No, I mean, I think look, there's a lot on the pancreas. I mean, honestly, we could probably do, a few of these focuses just on the pancreas. Amazing. A small gland, but so much that goes on in there.
That's awesome.
Yeah.
Well, thank you, Dr. Cruz.
Absolutely.
For the
Thank you.
pancreas education. And thank you all for joining us. If you'd like to connect with us, we would love to connect with you. Please go to our website. On the homepage, you'll see a magenta button that you can click and sign up for a free 30-minute wellness consult with myself. So don't all rush out there at the same time, okay? Also, be sure to give us a 5-star if you haven't already, so that other people just like you can find us. And then please don't forget to subscribe to the show so that you never miss another episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.